Okay, thank you for inviting me. My name is Isabel Ryden, and the topic for today is neuropsychological assessments in Neuro Oncology, enhancing patient insight. So I was asked to give a short background about myself. I'm a clinical neuropsychologist working with brain tumors patients since 2014. I work in the brain tumor team at the neurology department at Sahlgrenska University Hospital in Gothenburg, Sweden. My clinical work is mainly to do neuropsychological assessments for patients with brain tumors. I have a background as a licensed psychologist, and then I've done some specialist courses in neuropsychology. So in Sweden, you can do either a specialist thesis or a PhD. So since 2019, I'm a doctoral student, and I focus on low-grade gliomas and the functional outcome following treatment of low-grade gliomas. So mainly it's a longitudinal study where I try to assess all presumed low-grade gliomas before and after surgery up to 5 years. And my clinical work is closely related to research, different kind of research projects. For example, we have a long-term follow-up on patients treated for brain tumors during their childhood. We have a supramarginal study on high-grade gliomas, etc. So as a neuropsychologist in Neuro Oncology, I get most referrals from my own department, mainly from the neurosurgeons and neurologists, but also from oncologists, endocrinologists, and primary care physicians. Typically, patients with low-grade glioma come for pre- and post-operative evaluations, and also with long-term follow-ups. So I see other types of tumors as well, such as high-grade gliomas, meningiomas, pituitary adenomas, and those experiencing late effects after treatment. I also see patients that are candidates for awake surgery, and then also perform the intraoperative assessments. These patients are usually have tumors in their language eloquent areas. So I also do evaluations of fitness to drive, but more commonly I give recommendations to patients regarding return to work and how to better handle their everyday lives. So from the neuropsychological evaluations, I try to understand when and why symptoms have occurred, to understand what is changed and if symptoms are permanent or not, and provide feedback about this to the patient. Patients that have a good understanding of their functioning are more likely to succeed in making the changes that are needed to reduce their symptoms. So neuro-oncological patients commonly experience cognitive deficits and fatigue. So when I do my neuropsychological evaluations, I start with an interview where the patient and relatives are usually present. And here I try to understand how the patient functioned previously and what resources they have. So by talking to the relatives, I get a chance to find out more about possible changes in personality and how the patient's family members are doing. And before the cognitive assessment, patient get to fill out different kind of self-assessments, usually about depression, anxiety, and fatigue, but also sometimes about personality. This is like a more standardized way of getting to know more about factors that might affect cognitive functions. And then I do the cognitive testing, which takes about 1.5 hours. And then I compare the results to normative values and to the patient's presumed previous levels, or if I have done a previous assessment, of course, I compare it with that. And during the evaluations, I also make observations and try to see if the observations matches the information from the interview and self-assessments. I get a chance to see things like the patient's problem-solving strategies, their frustration tolerance, impulsivity, judgment. I can see how the patient handles instructions and stress, their ability to correct mistakes and to reflect about their own performances. And this tells me a lot about what strategies might be appropriate and what problems the patient might have using strategies. Yeah, and then I make the interpretation, of course, meaning I try to figure out what the results really say, if the patient have a real deficit or not, and if they're old or new. And based on the interpretation, I provide feedback. Usually I tell what can be trained and what needs to be compensated and how. I try to base my feedback on concrete situations in the patient's life, such as going to the store, being at a social event, or at work. I think it's also important to tell the patient what they can expect is not possible to compensate for fully, such as personality changes and memory functions. Yeah, and I work close to my team members and often refer patients to other people in the team for example, emotional support, economical help, or follow up on medications or adjustments. Yeah, in our team, we also talk about parents about how to talk to children about cancer and brain tumors, and we offer the children to visit us if they want. And within our team, we can also offer help to relatives. So I would like to give you an example of how a patient can experience a problem and how the neuropsychological evaluation can be helpful. It's quite common that patients have subjective complaints that are not really correct. Often this makes them worried and stressed. So a neuropsychological evaluation can be a way of enhancing insight by showing where the problems occur and what to do in different situations. So in this example, a patient has been diagnosed with a IDH mutated grade 2 astrocytoma, and he's had surgery followed by radiotherapy and chemotherapy. And this patient really wanted to get back to work and has recently tried to. And he describes that it didn't work out, that he couldn't get things done, but he was still exhausted at the end of the day. He says that he's worried because he walks around with a feeling that he has forgotten something all the time and think that he has memory problems. So I make the neuropsychological evaluation where the self-assessment showed that he has a high level of mental fatigue. He has some anxiety, but no depression. And he also has some problems with his sleep. The cognitive testing shows that he has attention deficits that become more prominent over time as he gets more fatigued. He has no problems with learning and memory, but are easily distracted or disturbed when surrounded by noise when trying to learn. He tells me that he likes his work and has a good relationship with his employer and his coworkers. He's known to have many great ideas and has come up with lots of great things over the years at the company. However, when asking about the current situation, it seems he has problems getting started, are easily distracted, have problems prioritizing his work, and of course also to finish on time. So the feedback he gets is reassuring in relation to having a memory deficit. I explained to him how his problems with attention is worsened when he's fatigued. His days at work have been long and working half-time would be more appropriate. I also recommend that he change the start of his working hours to 1 hour later in order to get a bit of rest before going to work. Or if he had a rough night with sleeping difficulties, for example, and also to avoid the first hours at the office where there are lots of people and lots of noise. I also advise him to keep a routine of coming to work at the same time every day and keep his schedule as similar as possible to reduce the feeling of having missed something. And we go through some of his working tasks and make adjustments like dividing them into subtasks, include taking micro breaks and avoid too complex tasks. I also advise him to talk to his employer about avoiding deadlines and tasks that colleagues are depending on, at this moment to lower his level of stress and anxiety and make his situation more manageable. So together with his employer, he will also look through what can be done at the office to optimize the environment, to avoid distractors and noise. And since this patient has a problem finishing on time, we decided that his employer will keep a close contact with him and have regular check-ins, especially in the beginning, to make sure he's on the right track. And this patient has recently finished radiotherapy, so the fatigue is expected to be better, even though he might not get well, which I, of course, tell him. And after our meeting, we have a telephone follow-up and possibly a new appointment for a new assessment within 6 months to see how things are working out and to better tell the patient about what to expect in the future. So as showed in this example, we try to give feedback to the patient to enhance his insight. And in our team, we work from the concept of a sense of coherence to promote well-being in patients. When meeting neuro-oncology patients, life is for them, life is suddenly very unpredictable, and we try to help them to find something to hold on to set goals and provide them with correct information and realistic expectations in order to make the situation more comprehensible and predictable. We also try to make the situation manageable by having a close teamwork and being available for the patient. And by being available for the patient, we can provide them with a psychological security. We also try to make life manageable by looking at what resources the patient have in terms of support, function, and economy. And we also try to support patients into finding what is meaningful in their lives. So I hope this has given you a better understanding of what neuropsychological assessment is and how it can be used to enhance patient insight. Thank you for listening.